Hi class, it's Nikki. Welcome to my slide presentation about lisdexamfetamine dismally, aka LDX, or also known by the brand name Vyvanse. As you know, for this assignment, I'm going to tell you a little bit about the drug and nutrient interactions and potential nutrient depletions that this medication can cause. And I'll get into a little bit about what this medication is used for. So who needs Vyvanse? Vyvanse is FDA approved for the treatment of attention deficit hyperactivity disorder, commonly known as ADHD. It has been approved for use in pediatric patients ages 6 through 17 since 2007 and received FDA approval for the treatment of ADHD in adults about a year later in 2008. In addition to ADHD, LDX was FDA approved in 2015 for the treatment of moderate to severe binge eating disorder in adults, also known as BED. What's particularly interesting is that recent studies suggest approximately 20% of children with ADHD also go on to develop eating disorders, including binge eating disorder. I'm going to briefly touch on Vyvanse in the context of binge eating disorder, and then we'll go ahead and shift our focus to use in ADHD. Vyvanse for binge eating disorder. There are only a limited number of studies on this. In fact, I was able to locate just two primary 12-week studies, both of which are referenced on the Vyvanse brand website. So you could go to their website and check them out. In these studies, adults diagnosed with moderate to severe binge eating disorder experienced a significant reduction in the number of binge eating days per week compared to a placebo. I wanted to highlight these findings briefly, primarily to show how the medication is being positioned and supported in literature provided by the manufacturer itself. It's also important to note that Vyvanse is a federally controlled substance classified as a Schedule II medication because it has a potential for abuse and dependence. And actually, right over here at the bottom is the actual warning from the Vyvanse website. For this reason, patients should always inform their prescribing provider if they have a history of substance misuse, including alcohol, prescription medications, or other substances. And Vyvanse can also cause harm if misused or shared with others. So really important not to share this ADHD medication. So let's talk a little bit about Vyvanse for ADHD support. So what is this medication exactly used for? Vyvanse is a central nervous system or CNS stimulant prescription medication used for the treatment of ADHD and binge eating disorder, as we mentioned earlier. The ADHD symptoms it is intended to address include inattentiveness, hyperactivity, impulsivity, and a handful of studies show that LDX is more effective than placebo or that it fails less often compared to no treatment or placebo in the management of ADHD. So that being said, really the studies are just showing Vyvanse against nothing, not Vyvanse against other ADHD medications. Don't really know how it compares at this time that way. Studies have also shown that Vyvanse can improve focus for up to approximately 14 hours in adults and up to 13 hours in children, which is why it's classified as a long-acting stimulant. So let's get into how this medication works. LDX is the first and so far the only long-acting stimulant in which the active drug is released biochemically in the blood rather than mechanically in the gastrointestinal tract. So because of this mechanism, it provides symptom support for a large portion of the day. The duration of therapeutic action of Vyvanse is longer than what has been reported for other long-acting stimulant formulations. LDX is also rapidly absorbed. So after oral ingestion, it enters the bloodstream and is active upon contact of red blood cells. Red blood cells then convert LDX into its active form, D-amp or dextroamphetamine. So Vyvanse is different than many other long-acting stimulants because it is not released or activated in the GI tract. LDX is considered inactive prodrug. After absorption, it enters the bloodstream and is converted by enzymes in red blood cells in two components, L-lysine, which is an essential amino acid, and DAMP, the active compound. The conversion process is steady and predictable, which contributes to Vyvanse's longer duration and smoother onset compared to immediate release stimulants. Once converted, D-amphetamine becomes the pharmacologically active form responsible for the medication's effects on the central nervous system. All right, as we discussed on the last slide, LDX is a prodrug. On this slide, we're going to get into a little bit about neurotransmitter effects and clinical considerations. And most importantly, we're going to start with the active form, talking about DAMP, because it increases the release and availability of catecholamines, particularly dopamine, which plays a central role in ADHD. Right, you hear about ADHD, you hear about dopamine. Dopamine supports attention, motivation, and executive function, which is why stimulant medication can improve ADHD symptoms in some individuals. Because D-amphetamine also affects other catecholamines associated with stress response, some people may actually experience side effects of LDX, such as elevated heart rate or blood pressure, headaches, sweating, palpitation, anxiety, or panic attacks, panic symptoms. LDX itself is detectable in the bloodstream for only a short time, typically converting to DAMP within about an hour, right? Hits those red blood cells. If you're hydrated, have that water, you're looking less than an hour for it to really become active and start working. The active compound has a plasma half-life of approximately 12 hours and is primarily excreted through the kidneys. So its clearance is influenced by urinary pH, which can affect duration and intensity. So how hydrated you are can really affect how Vyvanse works for you or your patient. So the pharmacological effects are important to understand when evaluating both benefits and the side effects of Vyvanse. So let's get into Vyvanse drug and nutrient interactions or any depletions, which is really the whole point to this course. As you probably know, almost every medication comes with some type of warning related to interactions with other drugs, nutrients, supplements, or herbs. There's almost always an interaction. And if you haven't been told that or didn't know that before this class, really important to dig into all the medications you or your patients might be taking. The primary nutrient interaction of concern with Vyvanse or LDX is ascorbic acid, also known as vitamin C. I love vitamin C. The acid and pH balance of the body is particularly important for the metabolism of this medication, as we talked about a second ago. So vitamin C can increase the renal excretion of amphetamine, which may make the medication less effective. So you can essentially burn through it quicker if you're taking it close to high doses of vitamin C, especially a vitamin C supplement. So if you're taking high dose of vitamin C supplements or you take Vyvanse at the same time of a high dietary source of vitamin C, it could potentially reduce the effectiveness of this medication. Because of this, it's generally recommended to separate vitamin C intake from Vyvanse, especially supplements, not just the dietary form, and taking vitamin C about 2 hours away from the medication, that might help it. So encourage vitamin C because it is a precursor of dopamine, but you do want to take it away from your medication, especially this medication, Vyvanse. So now we're going to get into the possible drug interactions with Vyvanse, also known as LDX, specifically related to CYP2C19. So interactions are possible because CYP2C19 is one of the primary enzymes involved in hepatic metabolism for a wide range of medications, including many commonly prescribed drugs and even herbs. So what's breaking down in your liver. So I've listed several examples here on the slide, including blood thinners and epilepsy medications, along with other drug classes that rely on CYP2C19 for metabolism. So PPIs, antivirals, epilepsy medications, whole lot going on there. So odds are if your patient's taking medications, they might be on one of those. So here are some of the herbs that are considered CYP2C19 substrate herbs. So again, herbs that are broken down through the hepatic system. And these are herbs that you should use caution with or potentially avoid when a patient or yourself is taking Vyvanse. The primary herbs of concern here were St. John's wort, valerian, ginkgo, and common sage. And interesting, coneflower, echinacea, and horse chestnut did not show significant negative interactions, even though they are sometimes grouped within this broader category of herbs. They're metabolized in the substrate. So the main herbs we want to be mindful here are St. John's wort, valerian, and ginkgo. So now we'll look at additional possible drug interactions with LDX, also known as Vyvanse. The list just keeps growing, right? So a lot of interactions, and these ones are important because they are CYP2D6 inhibitors, and they increase your risk of serotonin syndrome. So, Vyvanse is an ADHD medication that also approved for moderate to severe binge eating disorder. And one thing I did mention earlier is this active form of medication has also been used clinically in narcolepsy. I didn't mention that earlier, but it has been. There is use and shown some support for narcolepsy. Although it's not commonly diagnosed or routinely dosed for that indication, it can be used for that. And there is an increased risk of serotonin syndrome when Vyvanse is taken alongside certain medications, especially those CYP2D6 inhibitors I just mentioned. And here's a list of some of them right here on the right. And serotonin syndrome may present with symptoms such as agitation, restlessness, abnormal eye movements, diarrhea, rapid heartbeat, high blood pressure, hallucinations, increased body temperature, sweating, loss of coordination, nausea, and vomiting. So a wide range, right? Could be kind of hard to pinpoint if your medication's causing that because of the variety of symptoms. So something to be really mindful of. And this risk is especially relevant when Vyvanse is combined with the CYP D6 substrate medications like Vyvanse or other ones, including antidepressants and antipsychotics down here, which can increase the risk of serotonin syndrome when taking alongside the stimulants, other stimulants too, not just Vyvanse. Okay, so here's slide 12. Here's a beautiful little coneflower, aka echinacea, and a little bumblebee. And echinacea is a very popular herb and is often taken over the counter without much consideration. And we did see earlier that it doesn't always cause side effects, but it can. It can, and there are potential interaction warnings alongside Vyvanse, so we do want to be very cautious there. And sometimes these interactions or side effects may present as hypertension, headaches, spontaneous sweating, palpitations, anxiety, or even panic attacks. And because of this variability, it is important to be mindful when using echinacea, particularly in individuals taking stimulant medications like Vyvanse, and to consider avoiding or closely monitoring it to see if those symptoms appear. And I just really wanted to highlight these other ones, kava kava, berberine, golden seal, St. John's wort, and echinacea, because I do see patients on Vyvanse and trialing these herbs on their own from over the counter. So wanted to highlight those, right? Berberine is a hot topic right now, so many people are trying that supplement themselves. Okay, so continued potential interactions of Vyvanse. We'll look at some related particularly with MAOI inhibitors or MAOIs, which are a class of antidepressant medication. So, right, Vyvanse is now not compatible with a second set of antidepressant medications. And if you know anything about ADHD and even binge eating disorder, they're often co-prescribed with antidepressants and SSRIs and MAOIs. So, really important to talk about this. MAOIs can slow the metabolism of amphetamines, which increases their effects by amplifying the release of neurotransmitters. This can lead to symptoms such as headaches and hypertension. I noted on that earlier. In more severe cases, toxic neurological effects can occur, including impacts on cognitive function. So these have been rare but sometimes adverse events, including fatal outcomes. So even death has happened from this interaction combo. So really important to point that out. And because of this risk, Vyvanse should not be started within 14 days of stopping any MAOI or MAOI class antidepressant medications. And I don't know how often that's followed, right? Like that's a pretty severe warning. Oftentimes you hear patients are getting their medications adjusted. They're just handing a new prescription to go try out and try something new. So be mindful of that as you're working with ADHD patients or patients on MAOIs, that there should be a pause in between trialing new medications, especially stimulants and Vyvanse. And these combinations can significantly increase the risk of serotonin syndrome. Already went over the whole list of what serotonin syndrome could present like. And I think that's really important because oftentimes when I'm looking at ADHDers in like their organic acids test, they actually have higher serotonin levels than we think. So if we continue to increase that level, they might develop these SSRI symptoms. And the good news is we can help them out. So we'll want to stop the medication or supplement right away that we suspect causing the or the serotonin syndrome increase or symptoms. And it's usually reversible in a day or two after discontinuing the medication or supplement you think is triggering it. And some supportive strategies that I would like to share can also help reduce serotonin syndrome because I actually see this happen a lot more often than not. And so, from a nutritional lifestyle perspective, omega-3 fatty acids may be supportive here. They can be obtained from fish and eggs, fatty fish and eggs, or even a high quality fish oil supplement up to 2 grams for like a week can really help out here. Additional supportive strategies include exercise, meditation, journaling, spending time outdoors, and supporting vitamin D status. So, getting sunshine can be really helpful here, or even a SAD lamp if it's during winter. So while we did not go deeply into the effects specific to LDX in my presentation here, it's important to recognize that, like most medications, Vyvanse does carry potential side effects, and these should always be weighed out against perceived benefits, available research, and individual response. All right, that's what I have for everybody this evening. Thank you all for listening to my presentation. And after viewing this and listening, I would love to know if you've learned anything new or actually your thoughts about Vyvanse, if you would like to share that with me. Thank you so much.